Hey there, and welcome. If you follow healthcare in the UK, you've probably noticed something. The National Health Service feels like it's always being reorganized. But is that normal? Today, we're going to dive into a source that asks a really fascinating question. Why is the NHS constantly being rebuilt from the ground up when so many other countries' systems seem to stay remarkably stable? Right, let's just jump straight in with this killer analogy from the source material. The idea is that while other countries might, give their system a fresh coat of paint now and then, the UK's approach is more like a full-on kitchen remodel every election cycle. And that just hits the nail on the head, doesn't it? It perfectly frames this problem of constant, disruptive change that seems driven more by politics than by a need for steady improvement. So this really just lays it all out. On one side, you have the UK's constant cycle of rebuilding, what the source calls structural churn, and on the other, you have the stability that you see in most other universal healthcare systems. The argument here is that this isn't just a minor difference in style. No, it's a totally different way of thinking, and it has these massive knock-on effects. Okay, so let's get into our first section and be really clear about just how unusual this situation is. We're not talking about a few small tweaks here and there. We're talking about a consistent pattern of massive, top-to-bottom reorganizations that really does make the UK stand out. And what's so interesting is that this isn't just a hunch or a feeling people have. It's a real observation, backed up by organizations like the OECD. The source is very clear that when you look at its peers, the UK is a major outlier. So that just begs the question, right? If constantly remodeling the whole system isn't what everyone else is doing, what are these other successful countries doing instead? All right, that brings us to our next section. So if the UK is always renovating, let's see what happens when you don't. We're going to take a quick world tour of stability and look at 5 different countries that have figured out how to deliver universal care without tearing up the floorboards every few years. And we have to start with this truly mind-blowing example, Sweden. Okay, get this. Their counties first started running healthcare in 1862. And nope, that is not a typo. 1862. Now, obviously, the system is modernized, but its fundamental structure, local control, has stayed consistent for over 150 years. Just imagine the kind of long-term planning you can do with that kind of stability. So this slide kind of sums up the big lessons from our trip. You've got France, which shows that competition can work, but only if you actually build the right foundations for it first. Then there's Denmark, which reorganized once into sensible regions and then just let them get on with it. The Netherlands proves that regulated competition is definitely possible, but again, only if you have a really robust and stable framework around it. And then you have Canada, proving that a totally different, non-market, single-payer model can also deliver stability and keep costs down. You see the theme here. It's not about one perfect model. The common thread is the commitment to stability itself. So what can we pull from all this? What are the big takeaways? Well, the source we're looking at actually boils all these global examples down into a really clear set of principles for building a successful and, maybe more importantly, a stable health system. Let's dig into them in section 3. Okay, let's walk through these. First, coordinated regions just work better than constantly chopping things up. Second, it turns out stability itself is a massive performance booster because every single redesign comes with huge costs in time, money, and morale. Third, if you're going to talk about a market, you actually need the real conditions for one, not just the buzzwords. And what's really fascinating is that well-managed public services and not-for-profit providers, like you see in France, can actually be world-class. But maybe the most surprising point is the last one, the electoral system itself. Winner-take-all systems tend to encourage these huge, partisan overhauls, while systems built on consensus often lead to much more stable, long-term policies. But really, all of those other principles feed into this one big overarching idea, and this might be the most important one of all. Stop rearranging the furniture and start fixing the foundations. The argument is that the real work isn't in another massive structural blueprint, but in creating solid governance, sensible funding, and predictable long-term planning. And that brings us to our final section, and the big conclusion, the real fix. It's a very simple, but at the same time, kind of radical idea for what the NHS actually needs right now. This quote just sums it all up perfectly, doesn't it? Real, genuine reform isn't about another round of rebuilding. It's about creating a stable platform that lets the brilliant staff, the deep expertise, and all the public support that's already in the system actually thrive and get on with the job of making things better day by day. So what does the NHS really need, according to the source? It's this: 40 to 50 years of stability, a long-term cross-party agreement to just stop using the health service as a political football and instead to let it plan, adapt, and improve for the long haul. And that leaves us with one last, pretty provocative question to think about. In a world that's obsessed with constant change and disruption, what if the most effective, the most radical health reform we could possibly make is to have no structural reform at all? What if the real goal isn't to keep fixing it, but to finally just let it work?